Welcome back. In this video, we're going to lay the foundation for your CPR, AED, and choking relief training, especially as it relates to various ages. So we're going to go over a few things. What is CPR? How do you recognize cardiac arrest? What are chest compressions? How do you perform them? What is an automated external defibrillator? How do you use it? What is rescue breathing? How do you perform rescue breathing? Why would you do rescue breathing? We're going to go over choking, and then you're going to do a review. Okay, so the big question, what is CPR? Why is CPR? What is cardiac arrest? What do we even do? So let's go into the anatomy and physiology a little bit. I'll try to keep it interesting. Your cells keep you alive. Right? And so for your cells to be able to do the things that they need to do, they need oxygen. Right? Your cells need resources to be able to perform their functions of keeping you alive. Well, how do the cells get these resources? Well, they get these resources off of the blood. Right? So your blood circulates throughout your body through the vasculature in your body, and the cells are able to grab the resources that they need. As they make energy, they're able to put waste products back into the blood, and then it gets removed elsewhere. And so these cells need a supply of resource-rich blood to be able to function, right? And so how does the blood circulate throughout your body? Your heart. So every time your heart beats, you get a little more circulation of blood. It beats again, you get another circulation of blood, it beats again, right? So on and so forth, and that's how your body's able to circulate this blood. Now, when we get to rescue breathing, we'll talk about, okay, you're circulating blood with the heart. Now, how does the blood get the resources? Well, when you breathe in from the atmosphere, the oxygen that you breathe in is then put onto the blood, right? So every time you breathe, that puts the oxygen onto the blood. Every time your heart beats, it circulates a little bit of blood. And so you breathe, you put oxygen onto the blood, your heart pumps, 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 and it circulates the blood throughout your body. So cardiac arrest is the term for your heart not beating, right? And so in cardiac arrest, you're not circulating blood, you're not breathing, so you're not putting oxygen onto the blood, and so your cells are starving. And so what CPR is a system of interventions to take over for these systems, to circulate some blood, to put oxygen onto the blood, to make up for these failed systems until first responders can arrive and do some more definitive care. It's really important to make sure when checking for signs of cardiac arrest, you never spend more than 10 seconds. But what are the signs of cardiac arrest? Well, if you're comfortable feeling for a pulse, that's the definitive way to tell that their heart's not beating.
Chest compressions are your ability to take over for a failed heart. You can take one hand over the other, place them over the center of the chest of the victim, making sure to lock your arms. You're then going to push straight down at a rate of 100 to 120 times per minute. You're looking at adult chest compressions, but the principle will remain the same for children and infants. As you push down on the chest, you're compressing the heart, getting an ejection of blood. As you release your pressure off of the chest, you allow the heart to refill with blood in preparation for another chest compression, and this process will continue.
So that's all chest compressions are. The heart has stopped. Right? The way the heart works is it squeezes and we get an injection of blood. So the heart stopped. You push on the chest, get an injection of blood, let go, it refills, push back on the chest, we get another injection of blood. And that's chest compressions. And one of the interesting things is if that's all you do, you're going to help save the person. If all you do is recognize cardiac arrest, call 911, and do chest compressions only, you're going to help save this person. So those are chest compressions. Now what's an AED? Well, an AED is an automated external defibrillator. And so the heart to contract has to be told to contract. So there's an electrical system of the heart. Well, sometimes this electrical system goes a little haywire, right? And it needs to be reset. So to be able to reset the heart, we need to send a jolt of electricity through the chest of the patient, through their heart, stopping all of the electrical activity and allowing it to restart. So an AED, you open it, you need 3 steps. Turn on the AED, place the pads on the victim, and just do what it says. Right? And so when you power on this AED, you put the pads on the patient, the AED is able to analyze or interpret the electrical signal of the heart. And it's able to determine, is this a normal electrical rhythm? Is this abnormal? And if it's abnormal, does it need to be reset? And if it needs to be reset, the AED is going to say, stand clear, shock advised, it's going to charge up. And then it's going to say, shock advised, the red light will flash, you hit the shock button, a jolt of electricity goes through the victim, in an attempt to restart the heart, you immediately go back into your chest compressions. And that's the AED.
It's important to recognize that the AED is going to analyze the cardiac rhythm of the patient, and not in every case will a shock be delivered. In some cases of cardiac arrest, the AED will advise no shock, and advise for you to continue chest compressions. This is completely normal.
We're missing a component, right? We're missing putting the oxygen back onto the blood, right? Because the cells need oxygenated blood. So by doing chest compressions, we're circulating the blood. By putting the AED on the patient, we're attempting to restart the heart. The missing component is putting oxygen back onto the blood. We do that with rescue breathing, right? Um, and so there's a principle called compression to ventilation ratio. What it is for X number of compressions, you should deliver X number of breaths. So in adults, your normal compression to ventilation ratio is 32. So every time you do 30 chest compressions, you should pause for no more than 10 seconds. You should deliver 2 breaths to the victim. This is how we attempt to put oxygen back onto the blood and then circulate it throughout the body so the cells can continue to use it.
Throughout this training, we're going to show you the 3 different ways that you can deliver rescue breaths. The first, and what you're seeing here, is with the use of a bag valve mask, which fully isolates you from the victim. Another method is mouth to mouth, where you directly place your mouth over the victim's mouth and deliver 2 breaths. The third is similar to mouth, but placing a barrier device between you and the victim's mouth to help isolate from potential vomiting.
Okay, so now let's talk about choking. What is choking? Well, choking is another way of saying airway obstruction. The official term for that is foreign body airway obstruction. This is often food in kids, it could be toys, these sorts of things. And there's 2 types of choking. Right? There's 2 types of foreign body airway obstructions: partial and complete. So, partial airway obstruction is where only part of the airway is blocked, but you can get some movement of air, right? So, they may be able to have a raspy voice, they may be able to scream, they may be drooling. But if you're getting some air movement, only part of the airway is obstructed. So, in that case, call 911 and monitor the patient. You wouldn't want to do any choking relief interventions because in that case, it may actually cause the obstruction to become worse. Where we would attempt choking relief is in what we call a complete airway obstruction. So if the airway is entirely blocked with food or another object, you need to attempt to dislodge the object because no air is able to move. So how do you recognize it? The victim will not be able to speak, will not be able to move air, they won't be able to scream, anything like that. So if you notice those signs, you need to immediately attempt choking relief.
Let's take a moment to review the new knowledge we've gained. Pause the video and spend some time to attempt to answer these questions.